Good morning, everyone. It's me, Sanjita Pandit. Welcome back to my channel Medical with Sanju. I hope you all are fine and your studies are going better. Today, I present after a long time with MCQ questions. These questions are continuing up maternity nursing. We are trying to complete maternity questions. After that, only we start other subject questions. So, we start from 318 from today. Question number 318. Which should avoid during pregnancy? Option A smoking, option B alcohol, option C tobacco chewing, and option D all above. We advise the pregnant mother to avoid consumptions of alcohol, smoking, drug, tobacco chewing because it may increase the chances of intrauterine growth retardation, smaller babies, and abortion. So the right answer is option D, all above. Question number 319. Smoking is contraindicated in pregnancy because option A, nicotine causes vasodilations of the mother's blood vessel. Option B, carbon monoxide bind with hemoglobin and reduce available hemoglobin for fetus. Option C, cause dizziness to the mother, and option D is a bad lifestyle habit. Smoking is contraindicated into pregnancy because carbon monoxide bind with hemoglobin and reduce available hemoglobin to fetus. Option B is right answer. Question number 320. The nurse should counsel a 4-month pregnant mother regarding exercises. Option A. Exercise to raise the heartbeat above 140 beats per minute for 20 minutes daily. Option B. Perform gentle back lying exercise for 30 minutes daily. Option C. Try high intensity aerobic but limit sessions for 15 minutes daily. Option D. Walk briskly for 10 to 15 minutes daily and gradually increase this time. Option D. Walk briskly for 10 to 15 minutes daily and gradually increase this time. Option D is right answer. Question number 321. The nausea and vomiting commonly experienced by many women during the first trimester of pregnancy is an adaptation to the increased level of option A estrogen, option B luteinizing hormone, option C progesterone, option D chorionic gonadotropin. Nausea and vomitingलाई मोर्निङ सिकनेस पनि भन्छ। यो फर्स्ट ट्राइमेस्टर्समा कमन हुन्छ र यो कोरोनिक गोनाडोट्रोपिन हर्मोनको कारणले हुन्छ। फर्स्टमा 3 मन्थसम्म कोरोनिक गोनाडोट्रोपिन हर्मोनको लेभल हाई हुन्छ र यसले गर्दा नाउजिया र भमिटिङ हुन्छ। अप्सन डी इज राइट आन्सर। क्वेशन नम्बर 322. Morning sickness during early pregnancy is due to option A increased acidity hormone, option B increased acidity, option C increased progesterone level, and option D emotional factors. Because of increased human chorionic gonadotropin hormone. Option A is right answer. Question number 323. Morning sickness usually disappears by the end of option A 1 month, option B 2 month, option C 3 month, and option D 4 month. Morning sickness usually starts about 4 to 6 weeks after conception, peak between 8 to 11 weeks, and subside between 12 to 16 weeks of pregnancy. Option C is right answer, 3 months. Question number 325. During a regular prenatal visit, a pregnant client report heartburn. To minimize her discomfort, nurse should include which suggestions in the plan of care? Option A, drink more citrus juice. Option B, eat smaller frequent meals. Option C, limit fluid intake sharply. And option D, take sodium bicarbonate. Heartburn during pregnancy is a common due to relaxation of esophageal sphincter. Patients should advise to avoid overeating and not to go for the bed rest immediately after meal. हैन स्मल अमाउन्टमा खाना खानुपर्छ तर छिटै खानुपर्छ भन्ने चाहिँ भन्नुपर्छ. Eat a small frequent meals. Option B is right answer. Question number 326. Which of the following is the best method to relieve constipation during pregnancy? Option A. Lying flat on the back while sleeping. Option B. Increasing the intake of vegetables and fruits. Option C. Reduction of iron intake by half. And option D. Taking a mild over-the-counter laxative. Right answer is increasing the intake of vegetable and fruits. Option B. Question number 327. Nurse carrying a high-risk pregnant lady with heart disease must know which of the following valvular lesion cause death during labor. Option A. Aortic stenosis. Option B. Aortic regurgitation. Option C. Mitral stenosis. And option D. Mitral regurgitation. Mitral stenosis कमनमा हुन्छ कमनमा आउँछ यसको राइट आन्सर हुन्छ एओर्टिक स्टेनोसिस यहाँ एक्सप्लेनेसन दिएको छ mitral stenosis is the commonest heart lesion occur during pregnancy यो 80% हुन्छ and its mortality during pregnancy range between 5 to 15%. Mortality due to aortic stenosis is highest during perinatal period about 30%. Question number 328. Common valvular disease in pregnancy is option A. Mitral stenosis, option B. Aortic incompetence, option C. Aortic stenosis, and option D. Mitral incompetence. यसले भर्खर भनेको सबभन्दा कमन कुन हुन्छ mitral stenosis. It's a common option A. Question number 329. A prenatal client with a history of heart disease has been instructed on a care at home. Which statement, if made by the client, would indicate that the client understands her needs? Option A. There is no restriction on people who visit me. Option B. I should avoid a stressful situation. Option C. My weight gain is not important. And option D. I should rest on my right side. A patient with a history of heart disease should avoid stressful situation. Rest on the left side and avoid overweight or fluid overload and minimum contact to other. Option B is right answer. Question number 330. Kegel exercise are done in pregnancy too. Option A. Strengthen perineal muscle. Option B. Relieve backache. Option C. Strengthen abdominal muscle. And option D. Prevent varicose vein. Right answer is option A. Question number 331. A nurse teaches a pregnant client to perform Kegel exercise. Which statement by the client indicates an understanding of the people of this type of exercise? Option A. It will help prevent edema. Option B. It will help strengthen the pelvic floor in preparation for delivery. Option C. It will help reduce urine contraction. And option D. It will help prevent urinary tenderness. It will help strengthen the pelvic floor in preparation for delivery. Option B is right answer. Question number 332. Kegel exercise is done to option A. Strengthening bladder muscle tone. Option B. Prevent urinary infection. Option C. Assist in toileting. And option D. Promote fluid intake. Obviously, Kegel exercise bladder muscle tone बढाउनका लागि गर्छ. Option A is right answer. Question number 333. You are teaching Kegel exercise to a female patient. Her understanding for this exercise is correct when she said diet. Option A, it will reduce dribbling of my urine. Option B, it will reduce the recurrent urinary tract infection I get. Option C, treating my hemorrhoid. And option D, it will reduce fecal incontinence. A female understanding of this exercise is correct. When she stayed right, it will reduce dribbling of my urine. Option A is right answer. Question number 334. Value of a hearing the fetal heart is all to know about the following except. Option A, positive sign of pregnancy. Option B, proof that fetus is alive. Option C, help in diagnosis of presentation and position. And option D, placenta previa. Placenta previa. Option D is right answer. Question number 335. A 6-month pregnant woman came to hospital for consultation. Which of the following is contraindicated? Option A, tetanus toxide. Option B, potassium iodide 200 mg. Option C, ferrous sulfate 200 mg. And option D, retinol 2 lakh IU. You know very well the answer of this question. Right answer is retinol 2 lakh IU. Option D. Question number 336. One of the essential nutrients required during pregnancy is option A, potassium, option C, iron, option C, fat, and option D, high carbohydrate food. Iron, option B is right answer. Iron is most important. Question number 337. Inadequate intake of which vitamin by the pregnant woman may cause neural tube defect? Option A, niacin, option B, riboflavin, option C, folic acid, and option D, thiamine. The right answer is option C, folic acid. Next question in other videos. Thank you so much.